हेलो गाइस, वेलकम बैक टू द चैनल। दिस इज साइड एंटल व्लॉग्स। और आज के वीडियो में बताऊंगा किस तरीके से वी कैन राइट अ परफेक्ट प्रेस्क्रिप्शन, हाउ टू राइट अ परफेक्ट प्रेस्क्रिप्शन। So before writing the prescription, one important thing we should all know that we should have a thorough knowledge of what all medicines we are giving. What is the indication of that medicine? What are the uses? What are the contraindications for that medicine? And we have to take considerations for the patient as well, whether the patient is a child or a middle-aged man or a old man or a woman. So first of all, before writing the prescription, the main thing which we should have in our prescription, what usually make people make mistakes. So the first thing which you should have in your prescription is your name, your clinic registration number or your personal registration number, and the phone number and email ID of your particular clinic. If you can make a logo of your clinic, that will make your prescription very lively. And many people write many things in the prescription. For the dental prescription I'm particularly talking about, and also for the medical prescription. So on the side of the prescription, people write RCT implant. So in this present world where there is a lot of YouTube and Google, people already know that there is root canal and bridge and implants. So don't make your prescription too much clumsy by writing so many things, your degrees. So just write your name, your phone number, which is the only thing patients see in your prescription, and the medicines what you're going to give. Nowadays, many apps are coming and many softwares are coming which will give you a printed prescription, but that leads a lot of investment. And when you have a lot of patients in your clinic, at that time you can introduce that software and you can do that. But you can write a handwritten prescription also. So the first and foremost rule for writing a good prescription, it should be legible. So the medicine specialist or whoever the pharmacy store person should be able to read it ki what medicines you are giving. Second, the medicine should be a good brand, because if you give a good brand medicine, it will work very nicely on the patient. Suppose a patient is coming and it should be indicated for the purpose, correct purpose. Suppose a huge swelling patient has come with cellulitis and you gave onidazole ofloxacin, it will work, but it will not work that efficiently as you wished for. So in those cases, I write amoxicillin plus clavulanic acid. You can write, many companies are there. Okay, so GlaxoSmithKline, GSK Pharmaceuticals. You can write Augmentin, or you can write Abbott Pharmaceuticals का Amoxiclav 625. वैसे there are numerous, Indiclav, Princiclav, and Rabiclav, Clavum. So these all medicines you can write. There is no problem. So you have to choose wisely what kind of infection the patient is having. If the patient is having both aerobic and anaerobic infection, along with the aerobic antibiotics, you should also write some antibiotics which are acting against the anaerobic organisms, like metronidazole 400 mg. What I usually give is I give Metrogyl ER 600. That means metronidazole extended release 600 mg once daily, because there is a hassle of taking medicines, no? Every time, like take one medicine again after food, then again. So I try to give as less medications as possible to the patient. Okay. One second important thing is, whenever you're writing medicine for 5 days, you have to specifically tell the patient ki, what is the Indian mentality. Indian mentality, people like only take medicines for 3 days or 2 days. They will be telling the medicine store वाला 2 दिन का खाली दे दो फिर देखते हैं कम होता है कि नहीं. So tell the patients beforehand to not do kind of these kind of things. They may avoid the painkillers, but they should not avoid the antibiotics, because maximum people in India, 60 to 70%, according to WHO survey, are antibiotic resistant people. Means antibiotic won't work on them. There was a patient who came into my clinic. Her name was Namita, I'm also telling. And she came in before COVID, and she had severe diabetes. And so, what happened with me when I came to know about all this antibiotic resistance? So, I gave her Augmentin, which works very nicely on the patients for cellulitis. She had a pain in 3/7. I remember the tooth also. So, she came to me. I gave her Augmentin 625. And after 3 days, I recalled her. I saw there is no change in the swelling. She's having similar kind of pain, and she was on injections, continual injections every day. On the second day, I thought, okay, let me increase the dose. So I increased the dose to Augmentin 1 gram, means amoxicillin 1000 mg. I'm giving her 2 times. Still, after my 2 days of observation, patient swelling did not reduce. So I was little worried now because already I have given higher antibiotics to the patient. I asked digging about more history of the patient, and she said that she was admitted in some hospital and she used to take Augmentin 625 regularly for 1 month to 2 months for some other problem which she was having because of the high diabetes. Without showing the doctor, without doing the culture sensitivity, she was taking her own medications from the medicine store without any prescription. So that led to many problems and she got antibiotic resistance. So we took out the pus from the swelling area and sent it for culture sensitivity. And then we gave her what antibiotics we gave her. We gave her linezolid 600 mg and we gave her imipenem. Okay, if you Google it, you will be able to know it. Imipenem, which is a higher antibiotic which is used to give in burn patient, that medicine is prescribed. So after that, immediately the swelling subsided and didn't go for RCT of the tooth. Whether I removed the tooth, and immediately as you remove the source of infection, automatically the swelling will also reduce. And she was highly diabetic. So this is the case if you don't write an antibiotic properly. Next is in the prescription is the painkiller what you give. So there are many painkillers in the market, right? So while doing any kind of procedure, you have to make sure doing the RCT or extraction or impaction, patient doesn't have any kind of problem. Because how to grow your practice if the patient doesn't have any problem from your treatment, any problem from your medications, then only she or he will tell na to tell many people that okay, go and get treatment from this sir or ma'am. So now in swelling, what is the preferred drug of choice? So I give usually any medicine containing serratiopeptidase, aceclofenac, paracetamol combination, which is the best. Okay. However, I don't give in pregnant patients because the reason I have already explained in my earlier two videos of RCT in pregnancy and RCT in disimpaction, pregnancy disimpaction during the time of pregnancy. I have already made two videos. You can just check my last two videos. So now what is the problem after giving the zerodol SP? Sometimes what happens, patient comes again with pain, and many times what happens, patient won't take the medicines, but they will tell you pain is there. So you have to make sure the patient is taking the medicine. You have to ask the relative of the patient, you make sure that she or he takes the medicine, because many of people are reluctant to take the medicines, and 90% of the people lie. This is the most sad part of it, of dentistry. The truth is many people don't take medicines and they still come to you and they will tell, okay, I'm having this and that kind of pain. So you will have the painkiller. If the whatever painkiller, if the pain doesn't subside, then you have to give a supplementary painkiller along with that. In every 2-3 hours, you have to give a Ketrol DT, which contains ketorolac 5 mg. So that will drastically reduce the pain for the patient. So you have to see what medicines are working for which patient. You have to ask about the history of the patient, like patient is having any kind of gastritis or not. If the patient is having severe gastritis, write Dolo 650, Dolo 1 gram, no problem in that. Write a good pantoprazole, capsule Pan D40 or Pan 40 or Rebecine 20 mg, any medicine you can give. So don't forget to write the gas medicines. You can also give Rantac 150 mg for people who are not taking regular medicines. Rantac 150 mg is Ranitidine 150. So it also works in gastritis patients, and people are not giving because they are telling that they are having some side effects. But long-term proton pump inhibitors. Suppose a person is taking long-term proton pump inhibitors, that also can cause a lot of side effects. Like it will reduce the iron absorption in your body, right? So there's a side effect from one medicine, isomeprazole or Sompraz D, which my wife was taking, and it led to some hormonal changes, and that was giving a lot of problems. And we came to know about that medicine from a endocrinologist. So what was happening is, when she was taking Sompraz D, her HCG, human chorionic gonadotropin hormone, increased to such high levels, and oxytocin hormone levels were very high for my wife. So we stopped that medicines because proton pump inhibitors can also be dangerous in the long run. My father suffered from iron deficiency anemia because he took proton pump inhibitors for more than 4 5 years, and iron was not. absorb in the body. So when we did the peripheral blood smear for my father, he's no more now, I say. So we saw he's having my iron deficiency anemia, but that was due to chronic taking of proton per milliliters. So be very wise while writing the prescription, because your prescription is your signature. What medicines you are giving to the patient. Many patients come to you, if you have a good prescription, okay, oh, this is a nice prescription the doctor has given. And never write local drugs, because they may harm the patient. They may contain a lot of powder and there is no medicines. Okay, what I believe is, right, while writing the prescriptions, you should think about the patient also. Ki what There are many costly medicines, there are many cheaper medicines as well. Suppose after extraction, there is a poor laborer worker who earns 500 per day. So what I give Flagyl 400 mg, I give Combiflam, I give Rantac. देखो Combiflam में brufen है, that is harmful for health. But if you give for 3 4 days, nothing will happen to the patient. So these medicines come. Combiflam is 1 rupee. Whereas if you give $0 SP, that is costing around 10 to 12 rupees. So 1 rupee and 12 rupees. In 1 rupee, 10 medicines will come in 10 rupees. Flagyl is another 6 rupees, and gastritis medicine Rantac is another 26 rupees. Mein patient will have antibiotic, painkiller, and gas medicine. So see the condition of the patient also. If the patient is very poor, then you give these kind of medicines. So be wise while writing them. If you are having doubts, you can ask your seniors or any senior dentist who are writing medications. So writing medications is a very important part of dentistry. So it's a long video now. I can talk for long hours on this topic, but time has to be controlled. And if you like my video, you can watch my other videos as well. And please do subscribe to this channel, Sai underscore dental. I'll be soon coming live both on YouTube and on Instagram. And there's a course on graphy which was I was conducting, and due to my health issues, I could not make the third video, but I am making the third video right now. So it will come very soon. With it, I think it will take some time, because 15 20 days, because my clinic is under renovation, and a lot of work is there. So समय 24 hours कम पड़ जा रहा है, पर काम ज़्यादा हो रहा है. So you can also like my Insta channel Sai underscore dental, where I regularly post pictures of various oral lesions and various informative videos as well. Till then, take care. Have a very good day. Good love you all.